Let's talk about the Elevate procedure, the great new procedure for the right person. Dr. Ennis Plastic Surgery, Boca Raton, Florida. So what is the Elevate procedure? Everybody talks about the Elevate procedure, the Elevate Plus, myEllevate. It's all over the news. It's on the social media. It's on the websites. So what is the Elevate procedure? It is not a thread lift. It is not a facelift. It is a suture suspension. Very different procedure. So a facelift is absolutely the gold standard for fixing the lower part of the face. So an Elevate procedure is not a facelift. So if somebody comes in, they have jowls, they have nasolabial folds, they have marionette lines, they have heaviness in the central portion of the face, they're not a candidate for the Elevate procedure. The Elevate procedure is designed for somebody who just has some neck laxity. Maybe they've got little platysmal bands. Maybe they're too early for a facelift. They're young, but they're not ready for a facelift. The Elevate procedure is a suture suspension where a suture is placed underneath the neck to re-support the neck structures. Almost no incisions in the Elevate procedure, just a couple of needle sticks. Elevate Plus, a small incision behind the ear just to lift the skin slightly. So the Elevate procedure is a great procedure for somebody who's young, who's not ready for a facelift yet. It's a nice bridge to a facelift. Maybe they need 3, 5, 7 years before they want to come back and get a facelift. That's exactly what the Elevate procedure is designed for. It supports those neck structures, temporarily. Again, 3, 5, 7 years. Eventually, you're going to need a facelift. Or somebody, maybe they had a facelift and just starting to see this come back down. The Elevate procedure is a great procedure for that, to re-support this before they do a second facelift. Again, it's going to postpone the facelift. It's not the replacement for a facelift. Not going to fix the heaviness here, but it fixes this very nicely. So it's a suture suspension, not a thread lift. Threads are designed to put in the face and re-support that. And the problem with the old thread lifts was the old thread lifts were permanent. So they would put these threads in the face and try to lift everything up. Great concept, but the problem was the threads were permanent. They couldn't stop the clot. So the rest of the face continued to age and began to look at theater curtain because these threads are in there holding up parts of the face, but not others. So they quit making those, started using dissolvable threads. Dissolvable threads glow in about 6 months, and they tell you, oh, it's going to create scar tissue and help hold that up. Not true. Not going to help. It's a very, very temporary fix to a long-term problem. Gold standard is a facelift, in particular a deep plane facelift. A suture suspension myEllevate procedure is a nice bridge if the neck is the only concern and not the face. Get quick recovery, short procedure, either no incision or a small incision behind the ear. Much shorter procedure, again, quicker recovery. Great procedure for the right person.